Dear esteemed veterinarians, a very warm welcome to today's session on navigating canine reproduction, protocols, pitfalls, and practice. I would request everyone, please mute your mic. That will really help us to proceed. Please mute your mic, otherwise we will have to. Yeah. So I would request everyone to please mute your mic and keep your camera on switched off mode because it really distracts the session. So here we are honored to have with us our distinguished speaker, Dr. P. Sridevi, whose insights continue to guide and inspire the veterinary fraternity. I'm Dr. Vishal Sharma, a proud veterinarian and managing director of Oriheal Lifesciences. As a practicing veterinarian myself, managing two vet hospitals in North Delhi under the name Pets Planet India Pet Hospitals Private Limited, I truly understand the ground level challenges, hopes, and responsibilities we all carry. Buy a vet for the vet is a mission close to my heart. It gives me immense pride to share that Oriheal Lifesciences has grown into one of India's leading manufacturers of veterinary pharmaceuticals with a product profile of 180 plus products. But beyond numbers, what truly defines us is our purpose. We are a company built by a vet exclusively to serve the vets. Everything we do, be it innovation, education, or support, is centered around empowering our veterinary community. We are here with safe, trusted, and first in India veterinary solutions. Our product portfolio includes herbal medicines, which are India's first 100% safe, sugar-free, and side effect-free formulations, safe even for newborn puppy and kittens. Nutraceuticals, pharmaceuticals, injections, and grooming solutions, all carefully formulated for better compliance and outcomes. Breakthrough formulations including alprazolam suspension, tramadol suspension, furosemide suspension, metazapine suspension, butorphanol injection, Ultramax syrup, a research-based product for platelet enhancements, and many more were launched by Oriheal Lifesciences for the first time in India. A robust range of neuro, cardiac, ophthalmic, dermatology products tailored for small animal needs. Strengthening veterinary knowledge across India under our initiative Buy a Vet for the Vets. We have created one of the largest platforms for continuous veterinary education. Through regular webinars, we aim to spotlight advanced yet often unexplored topics like feline medicine, cardiology, neurology, radiology, ophthalmology, and many more, because knowledge remains our most powerful tool in saving lives. Your support is our lifeline. Friends, this journey is only possible because of your unwavering support. Every step we take forward, every educational effort, every new product is fueled by your belief in us. We humbly request you to support this mission in whichever way you can. Even a small order, a word of encouragement, or referring us to a fellow vet, each gesture keeps this mission alive. Ordering is very quick and effortless with us. Just call or text us on the number mentioned in the chat box. Our team will personally connect with you to take your order. 100% all benefits and supports directly goes to you, and we promise highest trade margins in the industry. Let's walk this path together to grow, to learn, and to raise the standards of veterinary care across the nation. Thank you for being with us today and for being part of this journey. Thank you so much. A special announcement for all webinar attendees. We are excited to share that with last webinar, we have launched our quiz contest series once again. The quiz will be held right after the session ends, so make sure you stay till the end to participate. Winners will receive Amazon gift card vouchers worth 2,500 each, and I congratulate the winners of the last series, and I hope they all have already received their gift vouchers. If you have been a part of our previous quiz contest, You already know how exciting and engaging they are. Get ready, stay with us till the end, and give it your best shot. So, now here I would like to say a few words about our respected honorary speaker, Dr. P. Sridevi. Dr. P. Sridevi began her academic journey at TANUVAS, Chennai, where she went on to earn her master's and PhD in veterinary gynecology and obstetrics. Her passion for teaching and clinical practice kept her at the university for more than 25 years, culminating in her role as professor and head of the Department of Veterinary Gynecology and Obstetrics at Madras Veterinary College until her retirement in 2019. Over 3 decades, Dr. Sridevi has become one of India's most trusted voices in canine reproduction. Veterinarians and breeders across the country seek her guidance, drawn by her blend of clinical expertise, practical insight, and compassion for animals. Her contributions include more than 800 guest lectures, 26 lead papers, and 9 keynote addresses at major national and international platforms. Recognized with 23 awards, including the Pet Care Award for Canine Excellence and the Tamil Nadu Young Woman Scientist Award, she keeps she has also authored the widely valued book Canine Reproduction Theory and Practice. Her work continues to inspire students, practitioners, and the wider veterinary community. Let's welcome Dr. P. Sridevi on this platform. Thank you very much, ma'am, for sparing your time and being with us at this platform right now. Thank you so much.
Thank you, Dr. Vishal Sharma. I think, yeah, we'll start the presentation and once again. So you can see my presentation, Dr. Vishal?
Yes, ma'am.
Yeah,
Yes.
thank you so much. And yeah, good afternoon, everybody, and welcome to the Oriheal's webinar series on canine and feline reproduction. So this is the part two of the series, right? Okay. And unlike the feline session or the feline presentation, now this presentation on navigating canine reproduction protocols and pitfalls in practice is totally going to be a case-based presentation. Okay, so this is not about theory about it. It's totally a case-based presentation. And as clinicians, you must have come across cases where the clinical signs do not meet your expectations. And so this session is totally about all about such cases where we are going to talk about the diagnostic tools and your clinical judgment, how it's both are going to work together to help you in your decision making. Yeah, at the end of this presentation, there are certain answers that we are looking for, okay? So what is the ideal breeding protocol and when to perform an OHE, and again, how to differentially diagnose vaginal discharges and how to manage a case of Pyometra with pseudo pregnancy, and what are the different options to medically terminate pregnancy. So I'll be presenting 8 different cases which are going to, fall within these lines, right? Okay. So let's straight away go on to case number 1. You are presented with a 3.5-year-old golden retriever bitch Bella in heat for 5 days. She had failed to conceive the previous 2 cycles, and the owner wants to breed her this time, and he wants to make sure that she becomes pregnant. Okay. Now, when you keep asking the history, you realize that both the matings were done with proven males, but on predetermined dates on the 9th, 11th and 13th after the onset of proestral bleeding. So there were no diagnostic tests that were performed to actually fix the date of mating. So in another additional history, the fact is that the male dog is located in Bombay and the male dog owner was willing to give only 2 mating dates. Okay, so now this is very, very tough. So because here the previous 2 cycles this bitch has failed to conceive, and now he wants the dog to become pregnant, but the issue is that the male is located in Bombay, so that means the male is located at a distance. Okay, and the male dog owner was willing to give only 2 mating dates. So given these options, which 2 breeding dates would you suggest for Bella, and what breeding strategy would you adopt? Now, the first thing that comes in your mind, okay, when a case like this is presented, now why did this dog didn't conceive the previous 2 cycles? Now, the first thing things to keep and consider is that was she mated at the right time or did she ovulate? These are two things that are actually first thing that come into my mind, okay. Now, other less possible reasons could be maybe there was an endometritis in the female, there could be a fetal resorption, luteal insufficiency, or a condition called as hypoluteoidism, use of harmful medications, occlusions of the this is kind of too far-fetched, but again still a part of your possibilities is occlusion of the uterus or the oviduct and the presence of anti-sperm antibodies. Maybe all these were also responsible for the dog not to conceive. But the first things, as I told you, you need to consider is, was she mated at the right time? Did she ovulate? Okay. So this is what, whenever we approach a case like this, I'm not going to, it's impossible for me to talk about all other things. But the first thing I would focus would be the right appropriate time of mating. Okay. In spite of that, if she doesn't conceive, then I need to look at other possibilities. Okay. So now first thing is, my plan is to lead you through the case. Okay. So I'm not going to straight away start with what I'm going to do. Okay. But certain things is you need to go through the basics, and which is going to help you understand why I am choosing certain breeding management tools. So I'll also take you to the different breeding management tools that are available, and finally I'm going to deal with our case, which tool is going to be appropriate for dealing with this present situation. Okay, so we all know that canines, they consist of 4 stages. The estrus cycle consists of 4 stages, namely proestrus, estrus, diestrus and anestrus. Okay, now as I told you last time itself when I was comparing a dog and a cat, I was actually telling you about the dog. So this dog in estrus, when she gets mated, if she becomes pregnant, she enters into a period of pregnancy, okay? Or if she does not get pregnant, she enters into a period of diestrus. But after pregnancy or after diestrus, all dogs have to enter into a definite period of anestrum. So anestrum is a normal part of the estrus cycle. Anyway, now as far as this case is concerned, we are more concerned with the proestrus and estrus. So I will not be discussing about the other stages at all, okay? So let's talk about each of these stages separately. So we say proestrus. Proestrus begins with the appearance of vaginal bleeding or spotting. Okay, now the reason I'm talking to you about this is it's also very important when I'm discussing about bleeding situation in dogs. Okay, so I said the very first day you see vaginal bleeding or spotting, we say this dog has entered into a estrus. Now the most important thing is that you need to understand an estrual blood will never clot. Now this is because of diapedesis of RBCs into the uterine lumen, and that's the reason why we say estrual blood will never clot. Now this is a differential, a part of your differential diagnosis for a bloody vaginal discharge in a dog. Okay, so here you remember that estrual blood will never clot. Now this duration of proestrus is on an average 9 days, but it's highly variable. It can range anywhere between 0 to 2 days to as long as 25 days too. Now I've done this presentation so many times before, but again I still want to emphasize on certain facts. Okay, now the vulva is swollen and edematous and hot to touch. That's why we use the colloquial word the bitch is in heat. Okay, and this bitch during proestrus you'll find us urinating in different spots, small quantities of urine, and this actually basically this is via, so she's kind of trying to attract the male dogs via the signaling pheromones in the urine and vaginal secretions. So now these pictures, the series of pictures given below, though they're kind of like cartoonish, there's so much of a kind of, what do you call that, information they're actually giving out. So during proestrus, now this you need to understand, a male will be ready to mount a female right from day 1 of proestrum. So we are looking for, or we are talking about the sexual behavior of the female. So during early proestrus, now what happens is the bitch will be very aggressive towards the male. She'll turn around, bite him, snarling, okay, showing her teeth, growling, snarling. So that's a behavior that is during early proestrus. Now as this dog is moving from early to mid proestrus, gradually the aggression is getting replaced by submissiveness. Okay, so during mid proestrus, now she's not going to snarl or show her teeth, but what she'll do is when the male is trying to mount her, she'll immediately sit down or she'll cover her perineal region with a tail. So there again she's not going to allow the male to mount and breed. Now, during late proesis, what happens is it's totally getting replaced by submissiveness. Now, the female may go and invite the male to mount her, but even now, what she will do is when the male tries to make mating attempts, she will immediately roll down on the ground and kind of like, still cover her perineal region. So, basically, you need to understand throughout the period of proestrus, this female is not going to allow the male to mount and breed. Okay. Now, estrus begins with the first acceptance of the male. You need to be very clear on this. The day the bitch allows the male to mount and breed, that's the first day of estrus. Okay. And it again ends. When does the duration of estrus end? It ends with the refusal of the male. So very clear. This definition holds good for, universally for almost all the species. So where estrus begins with the first acceptance of the male and ends with the refusal of the male. Now what I want you to remember when I'm trying to talk about this case, what I want you to remember is that this duration of estrus on an average is 9 days, but here too it's highly variable, anywhere between 2 days to as long as 18 to 20 days. So when I'm going to talk about proestrus and estrus put together, a dog can come and go out of heat within 2 days, or she can be continuously in heat for 45 days also. Okay. So there again, please remember, so when a case is being presented to you and somebody tells you, my dog, I finished all the mating, but my dog is still bleeding, the first thing you need to make sure is whether the dog is still in heat. That's why you remember the ranges. It can come and go out of heat within 2 days, or she can be continuously in heat for a period of 45 days. Okay. Now during estrus, the vulva becomes smaller and softer, and the discharge, which was initially bloody in nature, now becomes more serosanguinous, straw colored. Okay. And during this estrus, the female is going to exhibit her willingness to mate by what is called as a lordosis behavior and a tail flagging. You don't see a typical lordosis as you see in the case of felines. Okay. So where I hope you remember the felines, you have the crouching position, the hind quarters is elevated, but here in the case of dogs, you don't see this lordosis. A typical lordosis is not exhibited, but a willingness to be get mated is actually by the tail flagging, the deviation or lateral deviation of the tail. Okay. So there's also something which is hormonally, which is very important as far as canines are concerned. Okay. Now for easy understanding, I'm going to talk about a dog with 9 days of proestrus and 9 days of estrus. I call this bitch as an average bitch. An average bitch is one with a 9 days of proestrus and 9 days of estrus. Okay. So let's see what's happening in this particular dog. Okay. So at the onset of proestrus, your estrogen levels are going to increase, and by around day 6 or 7 of proestrus itself, they reach peak levels. Okay. Peak levels of estrogen is reached, after which it begins to decline. But here the decline is, it doesn't come to basal. Basal is only with the onset of diestrus. Okay. So only with the onset of diestrus, the estrogen level will come down to the basal levels. Now what happens is simultaneously, what is very peculiar in canine is that the progesterone levels are increasing. So normally this is very, very peculiar or unique to this species, because normally where is the source of progesterone? The progesterone comes only from the corpus luteum. And when does the corpus luteum form? Only after ovulation. But here in the case of canines, even before ovulation, there is an increase in progesterone levels. So where is this progesterone coming from? So what happens is these follicles, even before they ovulate, they are undergoing what is called as partial luteinization, and the partially luteinized follicles are beginning to produce progesterone. So why should this happen in dogs? Now why this is very, very unique to the species. Okay. So what happens in the case of canines is that this decreasing estrogen and increasing progesterone is the triggering factor for estrus, for LH surge, and subsequently ovulation to happen. So anything that is going to affect this decreasing estrogen or increasing progesterone levels, obviously then these events are going to affect it. Namely the estrus, LH surge, and ovulation is not going to happen normally. Okay. So that means clinically I'm using this for my, for my practice. Okay. So where based on the progesterone levels, I can actually predict when an LH surge is going to happen, when ovulation is going to happen, when fertilization is going to take place. I'll talk about it in much more detail. But you need to clearly understand that based on this progesterone level, I can predict when LH surge is taking place, when ovulation is taking place, and when fertilization is taking place. Now this is again very unique to the species. I cannot use progesterone for ovulation timing in any other species. Okay. So now as I told you, dogs are unique in that there is a pre-ovulatory rise in progesterone levels. Okay. Now, the basal level of progesterone is usually less than 1. When I say basal means there is no effect of progesterone at all. So when do I get a basal level of progesterone? Only during anestrus. When the dog is not in heat, there is no influence of hormones. At that time, the level of progesterone is going to be less than 1. Okay. Now, as a dog is moving from anestrus to proestrus, there also the level will be less than 1 only. But gradually it starts increasing, and during the time of LH surge, there is a level of 1 to 3 nanograms per ml. Okay. So that means once the progesterone level start increasing to 1, 2 or 3 nanograms, I know the LH surge has started. Okay. And during ovulation, the level of progesterone is 4 to 10 nanograms per ml, and during fertilization the level is 11 to 22 nanograms per ml. Thereafter the progesterone level goes on increasing to reach levels of nearly 80 to 90 nanogram per ml. So that's the level of progesterone you have in the case of canines. You don't have it even in a cattle. Okay. So this is the level of progesterone that you have in the case of canines. Okay. Now there's something also very unique to ovulation, because these are all basics. I want you to understand these basics first before we're going to deal with a case. Okay. So there's also something peculiar as far as ovulation is concerned in case of dogs. Okay. Now for easy understanding, once again let me take a dog with 9 days of proestrus and 9 days of estrus. So let's see what's happening in this particular dog. So on the 9th day, this dog is entering her estrus. Now on the 10th day, you have the LH surge. So that means an LH, so we assume, so based on what I'm trying to tell you is, we always think that an LH surge is going to happen 1 day after onset of estrus. No, it's not like that. An LH surge can happen even 3 days before the onset of estrus, 3 days after the onset of estrus, or on the day of estrus also. So this is also highly variable. So which makes it all the more much difficult for us to exactly time the breeding. Okay. So here, but as an example, let's say the LH surge is happening on the 10th day. Okay. Now, normally in the case of canines, ovulation happens 24 to 48 hours after the LH surge. Okay. And here again, what's unique in the case of canines is that all the eggs don't come out at the same time. It happens over a span of 4 days. Now, unlike, you remember, I hope you remember the feline session where we said that all the eggs come out at the same time and they're already ready for fertilization. But here in the case of canines, the eggs come out in a span of 4 days. Okay. So let's say on 12th, 13th and 14th and 15th. And for, as an example, let's say you have three eggs here, you have 4 eggs on the 13th, you have 4 eggs on the 14th, and you have 2 eggs on the 15th. Just an example. Okay. Now, what's very unique in the case of canines is that these eggs are only primary oocytes. They are not ready for fertilization. Okay, unlike the felines. And felines, once they ovulate, they're ready for fertilization. But here in the case of canines, once they ovulate, they're not ready for fertilization. It takes another 2 more days for them to become mature and fertile. That means it takes 2 more days for them to become secondary oocytes. So that means these 3 eggs which ovulated on the 12th, they are ready only on the 14th. These 4 are ready on the 15th. These 4 are ready on the 16th. And the last 2 are ready only on the 17th. Okay, so that means this is where. So when you talk about ovulation is between 12th to 15th, and here the fertilization period is between 14th to 17th. Now what's also very unique is that these eggs, once they become secondary oocytes, they can survive only for 24 hours. Okay, so that means these eggs which were ready on the 15th, they will disappear after that. Now these 4 will disappear on the 16th, these 4 eggs will disappear on the 17th, and the last 2 eggs which are alive up to day 18th, then they will also degenerate. Okay, so that means you have to be very clear on the events, right? So I'll come to that. Another fact in the case of dogs is that the sperms are capable of surviving for a minimum of 4 to a maximum of 7 to 11 days in the female tract. Okay. Now, given these facts, all what I've told you about, all right. Now, if I'm going to breed this dog, this is an average bitch with 9 days of proestrus and 9 days of estrus, right? Given this facts, okay, this dog, if I'm going to breed her on 9, 11 and 13th, will she conceive or not conceive? Now, the big question is that, okay. Now, this dog will definitely conceive because, as I told you, the last mating was on day 13. The sperms can survive for a minimum of 4. Even considering the minimum of 4 days for survival, the sperms will definitely be there to fertilize the eggs. 100% this dog is going to conceive. Now, what if this dog is going to deviate deviate from the so-called average? So that's what is our question, okay? So let's talk about that also later, okay? Now, so as I told you already, so when you're talking about events, when you're looking at this kind of this pictorial representation, now estrus is a separate event, okay? LH surge is a separate event, ovulation is separate, and fertilization is a separate event. So very clearly you understand the day of estrus is different from LH surge, it's different from ovulation, it's different from fertilization, okay? So that means based on the event that you're going to identify, your breeding strategy is also going to differ, okay? For example, if I'm going to identify the LH surge, I will breed the dog 4 days later. Am I right? Hope I'm right on that aspect. I'll breed the dog 4 days later when the period of fertilization starts. Okay. If I identify the period of ovulation, then I'm going to breed the dog 2 days later. If I identify fertilization period, I will breed the dog immediately. So that's what clearly understand. So when you're trying to use a breeding management tool, please understand what that tool can identify, what event it can identify. And based on that only, I'm going to use it for my breeding management practice. Okay. So let's now give you an example. Let's say this is a dog that is deviating from the so-called average, right? So this dog is having a proestrus of 18 days. She enters the estrus on the 19th day. She has an LH surge on the 20th. Ovulation starts on 22nd and fertilization is going to start on the 24th. Now this dog, if I'm going to breed her on 9, 11 and 13th, definitely this dog is not going to conceive, okay? So this is one of the, so that means you need to understand too early or too late a mating, okay, is one of the major contributing factors for failure of conception. Or even if possible, even if conception happens, the litter size is also going to be very, very low because of either too early or too late a mating, okay? Now let's go on to the breeding management tools that are there, okay? So with this basics, let's go on to the breeding management tools that we have. So the first one is going to be breeding based on sexual behavior. The second one is breeding based on cytology. The third one is breeding based on vaginoscopy. And the fourth one is breeding based on hormone assays. Now whatever is the tool, your goal in breeding is to have always, remember, is to have sperms continuously in the tract whenever ovulation is going to take place, okay? So that means that's your primary goal, right? Fine. So now with this, let's go on to each of these tools, and then finally we'll go on to what we can use for a present case, right? So now this, so when it's going to be breeding based on sexual behavior, what do you do is starting from day 5 of proestral breeding. Why on day 5? Why not on day 7? Why not on day 9? Because the earliest ovulation happens on day 5. So that means, so we start on day 5th, okay? We take the female to the male and we are looking for sexual receptivity in the female, right? Now what happens is, most important, never use the male to choose the breeding dates, because I've had a lot of time people coming to me saying, ma'am, I took the female to the male was ready to mount, female did not stand at all. Please remember, never use the male to choose the breeding dates, okay? So what we are looking for is sexual receptivity in the female. So if the female is not allowing, bring her back again. Keep doing this once in every 2 days until the bitch allows the male, okay? So that means the day she accepts the male, that means she has entered into her estrus. So now here clearly you need to understand, you're identifying only estrus. You do not know what will be the duration of estrus. You do not know when ovulation is taking place. So your strategy here will be to keep breeding the dog once in every 4th day until refusal. See, that's what you clearly need to understand. You need to start with the onset of estrus with acceptance, end with refusal, okay? Only when you're going to do this, that means within this period only ovulation has happened, 100% this dog will conceive, 100%, okay? So the clear thing you need to understand here is that the advantage is that it's an inexpensive method, no specific tools are required, and only thing is here it's preferred when multiple matings are possible. See, it may sound very funny to you, but I've had so many clients coming to you. They have the male with them, they have the female with them, but still what they would do is they'll put them together on 9, 11 and 13 and separate them, okay? So that's what you need to understand. When I have a male with me, or when I have a person or a friend or anybody who's able to give any number of matings, okay, possible, then I would go to breeding based on sexual behavior, okay? So here, this is a preferred method when multiple matings are possible. Now the disadvantage of this technique is that dominant females may not allow submissive males to mount. So here you're looking for submissive, or what do you call that, a sexual receptivity in the female. So suppose she's dominant, she'll always be aggressive towards a male, okay? And some females will have mate preferences. They may not like this male whom you actually want her to mate with, okay? Rather she'll be more interested in a male who's a street dog who will be near the gate, okay? And she'll be standing near the gate waiting for him. So these are things that are possible, right? Because here you're fixing the date of onset of breeding is going to be based purely on sexual receptivity, okay? So there again, this is a problem, this is a disadvantage you would face, right? Now the second technique is based on cytology, where what we do is you take vaginal smears, you actually make these smears, roll the cotton bud on a glass slide, and then you stain them and you examine them. So these are the different cell types that you're looking for. I'm not going to talk about cytology, but here you need to understand these are the different cell types you're looking for. And the most important thing is the presence of more than 80% of these two cell types is indicative of that the dog has entered into cytological estrus, okay? So that means I need to have in a smear, when I have more than 80% of superficial plus cornified cells put together, then I know this dog has entered into estrus, okay? So this is how we do based on cytology. So what we do here is you start again similarly, starting from day 5, we collect smears starting at intervals of every once in 2 days. The day the smear shows more than 80% of superficial and cornified cells, I know this dog has entered into estrus. So here again, please remember the event I'm identifying only estrus, okay? I still do not know what will be the duration of estrus. I do not know when ovulation is going to take place. So here also, I need to breed the dog once in every 3 to 4 days until refusal, okay? Please remember why every 3 to 4 days? Because the sperms can survive for a minimum of 4 to a maximum of 7 to 11 days. I'm not giving the credit of 7 to 11 days, considering that they can survive for 4 days. Breed once in every 4 days until refusal. So this ensures that the sperms are going to be there whenever ovulation is going to happen, okay? So that's the second thing, right? Now the third technique is based on vaginoscopy and hormone assays, where these two are actually used to predict the time of ovulation. Now here, the most important thing is there you're identifying estrus, right? But here you're identifying a very, very specific event, that is either the LH surge, the ovulation, or the fertilization period. So that means daily monitoring or an alternate day monitoring is very, very important, okay? So what we do is vaginoscopy is we introduce the scope and we look for changes in the vaginal mucosal folds and contours. So as I told you, during proestrus, when estrogen levels are very high, the mucosa is actually highly edematous. It's thrown into folds. Now as the dog is moving from proestrum to estrum, what's happening is estrogen levels are decreasing and progesterone levels are increasing. So once estrogen levels decrease, what is happening is there is going to be withdrawal of fluid. So once withdrawal of fluid happens, the mucosa begins to shrink. And this period, which is called as shrinkage without angulation, you can see the contours, they're not angulated, right? Okay, they're still rounded. So this shrinkage without angulation period, this is corresponding to the LH surge or the ovulation, okay? And continuous shrinkage results in angulation. So you see this angulation, the peaks, the mucosa is thrown into peaks and folds. So this shrinkage with angulation period called as crenulation period. Now this corresponds to the fertilization period. Okay, so very clearly you need to understand, if I identify the shrinkage without angulation period, I'm going to breed the dog 2 days later. If I identify the shrinkage with angulation period, I will breed the dog immediately. Okay, now the advantage of this technique is that, so what we do here also is, starting from day 5 or 7, alternate days, daily or an alternate days, I'm going to go on collecting I'm going to perform the vaginoscopy, and then when I'm getting the shrinkage without the angulation period, that indicates ovulation. And I'm going to breed the dog 2 days later and rebreed after 48 hours. Okay, now the advantage is it can identify ovulation or the fertilization time, and even a single mating during the fertile period is enough to bring about a very good conception. Now the disadvantage is subjective. Okay, so which I may think as angulation, shrinkage without angulation may appear something different to you, okay? So it's subjective. Of course, it comes with practice and it comes with routine, as a routine management. And then again, the equipment involved is very expensive. But here again, see, with all the video endoscopes or all this monitoring or the video recording, all these aspects, it's going to take you around more than 10 lakhs, okay? But it doesn't have to be that. If all I have to do is just to look for the vaginoscopic changes, I can use a pediatric proctoscope or an otoscope. It's amazing, right? Okay, so that's also an excellent tool. So now the last technique which I'm going to talk about is the hormone assays. Now LH is the hormone responsible for ovulation. So that means if I identify LH, I know when ovulation is going to take place. It happens 2 days later. Am I right? But what happens here is that the LH assays, the LH estimations cannot so be easily done in the case of canines. Okay, I cannot collect because most laboratories, so LH is species specific, right? So human laboratories cannot check the LH samples that they cannot estimate the LH, canine LH. So in fact you need to have either a canine LH antigen or an ovine LH antigen which is antigenically similar to that of canine LH. So there again, this is not possible on a routine practice. So we do have LH kits that are available, not here in India, but they are available abroad. But the only disadvantage is that shelf life is very poor and daily testing is required. So actually practically itself, this is not an excellent technique. No, in other words, progesterone, I already spoke to you about progesterone. Now the progesterone level of 4 to 10 is suggestive of ovulation, and a level of 11 to 22 is suggestive of the fertilization period. Okay, so here progesterone can be estimated both quantitatively or qualitatively. So qualitatively means you have semi-quantitative assays that are available. I worked through all these kits. Okay, amazing results are you can get the results within a 30 minutes time. It's a turnaround time is just 30 minutes. Okay, but I still feel quantitative estimation is much more easier. Most of you have the assay systems with you, or you can just give the sample to a laboratory. Any laboratory, human lab can test it and give you the values, because again steroids are not species specific. Okay, so estrogen, progesterone can be given to a human laboratory and you can test them. So to me, when I even investing on all these kits are going to be much more expensive, I can straight away go and give these samples to a laboratory and get the results. So quantitatively, I know what is the value of progesterone. Okay, so now based on this information, I've given you all this information. Now let's say, what about coming to our case? Okay, a recap of our case. The male is located in Bombay and the male dog owner is willing to give only 2 mating dates. Okay, so now having these 4 tools, your sexual behavior, vaginal cytology, vaginoscopy and progesterone assays, now which is going to be suitable for our case? Okay, so here clearly you need to understand these 2 techniques cannot be used here, because they require, when you're using these 2 techniques, they require multiple matings. Okay, so when there's going to be restricted mating, you need to go only for either vaginoscopy or progesterone assays. Now given the fact that this equipment is going to be expensive, let's talk about progesterone assays. Okay, so in this case, let's say I'm going to go for a progesterone estimation. Okay, now this is a set of values I've given you, right? So on day 7 the level of progesterone was 0.49, on day 9 it's 0.72, day 11 it's 0.68, day 13 it's 1.46. Please don't panic, because I again know I've seen, even when I ask the vets to do these progesterone estimations, come back to me with a value, they start panicking, because to them everything is fixed in their mind is 9, 11 and 13. Okay, and by 9th day or the 11th day, even if the value is less, don't bother, because as I told you, ovulations can happen as early as day 4 to even as late as 21 days of the cycle also. Okay, so I don't even expect an increase to happen in some dogs even by 20th day or 21st day. So continue to take the progesterone sample. So on day 11 it's 0.68, 13 it's 1.46. Okay, so now 1.46, now you know that the LH surge is starting, right? So then it's 2.38 on day 15 and 4.66 on day 17, and on day 19 it's 10.54, day 21 it's 6.46, and 23 is 23.44. Okay, so now given these values, which 2 dates will you breed? Okay, now this is the most important thing. Which 2 dates will you breed? Now you have only 2 dates, so you just don't give random dates. Okay, you need to do a logical thinking, and which 2 dates will you give? Considering the fact that I need to give the owner time to move to Bombay also. Okay, so if you guys were there in front of me, I would have questioned you all, but unfortunately I need to give the answers outright here itself. So you need to understand, day 17 is 4.66. That means indicates that ovulation has started. In fact, I would not be going for the other tests at all. This is just to confuse you. Okay, so here once the level on day 17, once the level reaches 4.66, I know ovulation has started. Okay, so I tell the owner, okay, come on, move to Bombay, right? And I'm going to give him 2 mating dates: breed on day 19th and rebreed on day 21. I hope you guys agree with me, okay? Because again, remember, at the time of ovulation, this egg is not ready for fertilization. It takes 2 more days for it to become fertile, right? So that means I'm going to I'm going to ask them to move on day 17, but breed on day 19 and rebreed on day 21. 100% this dog is going to conceive, and the litter size is also going to be very high, okay? This is not because your progesterone estimations has caused more ovulations to happen. No, you're covering almost all the eggs, okay, which are fertile, and that's why the litter size is always high when you go for progesterone estimations. Okay, so this is again to reduce the cost of the progesterone estimation. What we can do is we can start off with the progesterone. We can start with vaginal cytology. Keep doing it once in every 2 days until you get 60% of superficial and conified cells. Don't go for 80% until you get 60% of superficial and conified cells in the smear. Then I start the progesterone estimations. Okay, so that means I'm reducing the number of progesterone tests that I'm going to perform. So I go on doing the progesterone testing every day or every alternate days until I get a value of 4 nanograms per ml. Then I'm going to transport the dog, breed it after 2 days and rebreed after 48 hours. So this is with the case number 1. So let's go on to case number 2. You are presented with a 3-year-old crossbred female Cookie in estrus for spaying. You convince the owner to come for surgery after 1 month when all the heat signs subside. Okay, you don't want to do the surgery during the estrus. You feel that there will be a lot of bleeding during estrus, so you ask the owner to come after 1 month when all the heat signs subside. Okay, now after 1 month you are going to perform an OHE, and then within 2 to 3 days the owner is bringing back the dog to you with a complaint that there is mammary gland enlargement, milk secretion and nesting behavior. Now what exactly is this case and what is happening with this? So you've done a surgery. So this dog was in heat. You ask them to come after 1 month. You're performing a surgery, and after surgery, 2-3 days after surgery, the dog is brought to you with a history that there is mammary gland enlargement, milk secretions and nesting behavior. What exactly is happening here? Okay, so for this again you need to know a little bit of base, right? So once again, let's take a dog with 9 days of proestrus and 9 days of estrus. So here, you know, the estrogen goes like this, comes down. So on the day 18, 9 plus 9 is 18th day, the dog is entering into a diestrum, right? So the estrogen level comes to the basal. So now the progesterone is increasing this way. It goes on increasing, on. So it reaches nearly 50 to 80 nanograms during the diestrus period. Now around day 30 of the cycle, that is when the dog is into diestrum, this progesterone level starts to gradually decline. Okay, it's not coming to basal level, it's gradually declining, but comes to basal level only with the end of the diestrus and the onset of anestrum. Okay, so very clearly you need to understand, I still have very high levels of progesterone. Okay, so clearly understand, I require only 2 nanograms per ml of progesterone to maintain pregnancy in a canine, but I have nearly 50 to 80 nanograms. So here it's reached its peak level and still it's decreasing, but it's not come to basal level. Basal level is reached only with the onset of anestrum. Now around day 30, prolactin levels are increasing. Now this is very, very peculiar in case of canines. Now what is the role of prolactin? Okay, now you need to understand here is that prolactin is responsible for maintenance of the corpus luteum. In all species, LH is not only responsible for ovulation, it is also responsible for the maintenance of the corpus luteum universally, including the human beings. Okay, so LH is also known as luteinizing hormone, or also known as the lutotrophic hormone. It has a trophic effect on the corpus luteum. But in the case of canines, what happens is that the role of LH as a lutotrophic effect is going to be questionable. Okay, instead prolactin is a major lutotrophic hormone. But what is happening? Why am I getting prolactin only after day 30? Because here itself the CL is formed, right? So, but why am I getting prolactin only after day 30 is that up to first 30 days, the corpus luteum is going to be independent of lutotrophic support. Please remember this when I'm going to talk to you about MTP, right? Okay. So here up to 30 days, the corpus luteum is independent of lutotrophic support. It functions autonomously. Only after 30 days, this prolactin is going to take over the maintenance of the corpus luteum. Now what is peculiar here as far as this case is concerned is that This drop in progesterone is brought about by an increase in prolactin levels. So that means there is an inverse relationship between progesterone and prolactin. Okay, so that's the take home message at this point. Okay, and this for this case. So there is an inverse relationship between prolactin and progesterone. So towards the end of the diestress, when the progesterone almost drops to basal level, once again prolactin will shoot up. Okay, once again prolactin will shoot up. Now this is going to happen in a pregnant dog also. At the end of the pregnancy, when progesterone drops, prolactin will shoot up. At that time, that prolactin is required for mammary gland enlargement, milk secretions and all. But here, in a non-pregnant dog, there is no need. But still what happens, this drop in progesterone is a triggering factor for increase in prolactin. So let's say I am having around 100 dogs which are non-pregnant. In all the 100 dogs, this drop in progesterone will trigger the increase in prolactin. But all dogs will not exhibit signs of pseudo-pregnancy. Only if this dog is sensitive to prolactin or it has a higher level of prolactin, it will exhibit clinical signs of pseudo-pregnancy. So please clearly remember, there are two things you need to take home message at this point is that there is an inverse relationship between progesterone and prolactin. Okay, and again the increased sensitivity to prolactin or a higher level of prolactin is the cause for the clinical signs of pseudo-pregnancy in any dog. Okay, so that's again, please remember that. So usually when you talk about pseudo-pregnancy, when do you see the pseudo-pregnancy? You'll see it only at the end of the diestress period. Occasionally you can see in this stage, but mostly it will be seen at the end of the diestress period where the drop in progesterone triggers the increase in prolactin levels. Okay, so now coming to your case. So what exactly is happening to our case, right? So what happened in our case is that during diestress, which hormone is predominant? The progesterone is predominant because the corpus luteum is there and the progesterone is going to be predominant. So when I'm going to do an ovarian hysterectomy, I'm going to suddenly withdraw the progesterone levels. Okay. Now sudden withdrawal of progesterone has caused an increase in prolactin levels, and if the dog is sensitive to prolactin or higher level of prolactin, then it may result in a pseudo pregnancy. Okay. So that means, so here the pseudo pregnancy is brought about by a sudden withdrawal of progesterone following an ovariectomy during diestress, or the termination of long-term or short-term progestin therapy, or a prostaglandin-induced abrupt luteolysis, or an anti-progestin therapy. In all these situations, your sudden withdrawal of progesterone can initiate the trigger the signs of pseudo-pregnancy. Now the only issue is that this pseudo-pregnancy that you've created is a semi-permanent condition. Okay, that means this is going to exist lifetime. So that means you need to put this dog on an anti-prolactin drug throughout its life. Okay, so that's what you need to be very careful in this situation. Okay, so that means the ideal time. So when do I do an OHE? I don't want to do it in estrus because there's a lot of blood supply. I don't want to do it in diestress because it may trigger an episode of pseudo pregnancy. So when do I do it? The best time to perform is it during the unestrus period. That means approximately around 4 months after a onset of estrus. Okay, after end of estrus period, after onset of estrus, right? Okay, so this is with case number 2. Now case number 3, a 3-year-old German Shepherd female, Lassie. She was mated 48 days back. She's brought to you with a history of occasional vomiting and a bloody vaginal discharge. Okay, so this is actually a dog mated 48 days back. She's brought to you with a history of a bloody vaginal discharge. So we need to think about this is a very common case that will come in your practice. Okay, and the first thing that comes into your mind, mated 48 days back, now she has a vaginal bleeding, so obviously it's a case of abortion, or you start treating her for abortion, right? Okay, and you put her on antibiotics and things like that, and you assume it to be an abortion case. Okay, but there are a list of situations that can result in a bloody vaginal discharge post mating. Okay, so let's look at them one by one. So the first thing is, as you said, it could be an abortion case, but it could also be vaginitis. Okay, now vaginitis can happen at any stage of the cycle, and the discharge can be purulent, can be bloody in nature, yellow, grayish, white. It can be any of the colors, right? So it could be vaginitis. It could be even Pyometra or cystic endometrial hyperplasia. See, you need to be very clear on a definition of Pyometra. Pyometra is a diestrous disorder. It happens only during the diestrous period. Am I right? Okay. So here what happens is, so which is predominant during diestrum? Progesterone is predominant during diestress. So that is the hormone that is triggering the onset of Pyometra. So in this case, typically, this is a case where she was mated 48 days before. She was in estrum, she was mated 48 days before. So now obviously she is in diestress where the possibility of Pyometra or cystic endometrial hyperplasia is very, very high. So that also comes as a part of your differentials. Then it could be cystitis, it could be cystic calculi, it could be trauma, though not very common, but it could be trauma also, and it could be TVT or any other neoplasms of the reproductive and the urinary tract. It could be also split heat. So what exactly is the split heat is when a dog, let's assume she comes into heat, you breed her, but what happens is this dog does not ovulate at all. Whatever follicles that have developed simply undergo atresia, okay? They don't ovulate at all, they simply undergo atresia. Now 4 to 8 weeks later, once again the dog enters into a proestrus and estrus. Now what's very peculiar is that the second half, so that means one heat has been split into two halves, okay? But the second half is always an ovulatory estrus, okay? So here, logically, in any case, if I am taking, if she was in heat before, okay, so that means when she was mated 48 days back, she would have been in heat, okay. Now again 4 to 8 weeks later, once again she comes back into heat. So the first thing, as I told you, always you think about is an abortion. But what if she is having a split heat? And what if this is a split heat? That means the second half of split heat is going to be an ovulatory heat. So even if I'm going to any type of thing that I've taken to breed her during the first half, she's never going to conceive because ovulations would not have happened. Okay. So this is more common. This split heat is more common with the onset of puberty and again in older dogs. Okay. And some dogs have a tendency to have a split heat almost in almost all the cycles. Okay. So split heat is one of your differentials, and it could be also immune mediated thrombocytopenia, coagulopathies, or probably the dog is pregnant but with vaginitis, cystitis, TVT, etc. in all these situations. So most important is you have a set of differentials. You almost have 11 differentials in your hand. You need to narrow down the differentials because this is too much for you to do a diagnosis. Okay, so how to narrow down my differentials? So I can have my history. What questions I can ask in my history that can help to narrow down? Not see what date was she mated. All this you know because she was mated 48 days before. Okay, all this is not. That's a standard questions that you're going to ask. Two specific questions that can help to narrow down your differential type. So the first question will be, one, when do you see the discharge? He says, ma'am, I see the discharge only at the time of urination. Then obviously your thought should go to cystitis or cystic calculi, okay? But instead he says, no ma'am, I see this spotting everywhere. Wherever she sits down, I see this spotting. Then okay, I think I should also think about split heat, okay? But other reasons also I could have a spotting or lots of bleeding would be there, okay? But spotting is very characteristic for estrum, right? And then again, the next question I would ask is, what is the nature of the discharge? Is it clotted blood or unclotted blood? So the moment he says, no ma'am, it's not clotted blood, I see it spotting and it just dries off, then first thing that you are going to narrow down in your differentials is split heat, okay? But if he says it's clotted blood, then obviously it's not split heat. You need to look at other things that are associated with clotted bloody discharge, okay? So only these two questions you can ask in your history that can really help you in your narrowed down differentials, okay? Then I go for a physical examination where I do a general examination, mammary gland examination and a genital examination, okay? I do a genital examination to check for the appearance of vulva, where it is swollen or edematous. Now, the vulva is swollen and edematous, it is only in two conditions, okay? In the case of vaginitis and in the case of estrum. Only in these two situations, the vulva will be swollen and edematous. Of course, a very thing is that maggot wounds, definitely a maggot wound inside will also have an edema, and I cannot include that in this. Right, okay. So when I'm talking about logically a reproductive situation, then it's going to be either estrum or vaginitis. There will be a vulval edema, okay. I'm also going to look for the nature of the discharge, and I'm going to look for the presence of any TVT or fibroids present, okay. So now with this, let's go on to the diagnostic procedures in hand, okay. So when it comes to reproduction, we normally depend on diagnostic procedures such as cytology, your ultrasonography, vaginoscopy, radiography and clotting profile, okay. Now in this case, let's say I do a vaginal cytology, okay. And I already mentioned to you the cell types here. So predominantly if I have superficial and cornified cells, I know this dog is in eastrum. If I'm going to have predominantly intermediate cells, I know the dog is in diestrus. Okay, these two is what I can actually talk to you about right now. So when I have these cells, then the dog is in eastrum. If I have intermediate cells, the dog is in diestrus, right? So let's say this dog is having, this is the type of cells that I'm seeing, okay? So here I'm seeing mostly superficial cells. So what does this indicate? The dog is in eastrum. So obviously the differentials I'm narrowing down is to split heat. Okay, I'm eliminating all the other conditions. I straight away go and diagnose this case as split heat. And again, at the advantage I told you is if you diagnose split heat, you can breed the dog. And because ovulation is going to happen during the second half of split heat. What if I get a cytology picture like this? That means I have predominant of intermediate cells. So obviously this indicates that the dog is not in estrus. So I am eliminating split heat. But I still have all the other conditions in my hand, okay? So there again, I still need to go do other diagnostic procedures to confirm my diagnosis, okay? Now what if I have a lot of neutrophils? Intermediate cells with a lot of neutrophils in the smear. It could be either vaginitis or it could be pyometra, but I still need to go for a further diagnostic procedure, namely ultrasonography, to narrow down or to confirm my diagnosis, okay? But here again, with my cytology, I can look for TVT cells. TVT cells are very characteristic where you see they appear very similar to that of parabasal cells. But most important is you can see the eccentric nuclei and again the vesicles within the cytoplasm. Okay, so cytology can be used to stage the cycle, to look for TVT and to confirm whether it's a case of vaginitis. Okay, now beyond this, I cannot use cytology in this particular condition. So my next diagnostic procedure would be ultrasonography. Now here you need to understand, for me, for a person who is working in reproduction, and ultrasonography is extremely important, okay? It's an extremely important diagnostic tool. So it's like how a skin scraping is for a dermatologist and ultrasound is like, it's like that for us, okay? So most often we'll do a smear, okay, nothing, then go for an ultrasound, check it out, nothing, go for the next thing. So this is what I said. So with all my years, all my 3 decades of my practice, my experience, you take off my ultrasound from me, I'm zero. Okay, so you need to clearly understand this. I'm not selling you guys an ultrasound. It's clearly you need to understand the importance of ultrasonography in your diagnostic or in reproductive practice. Okay, so here if I use an ultrasound, I can now diagnose abortions, diagnose pyometra, or rule out. It's anyway, I'm either diagnosing or eliminating the condition. I can check for cystic endometrial hyperplasia, I can check for cystitis, cystic calculi, and I'm going to check for neoplasms, okay? So I'm eliminating most of the conditions that I have mentioned to you here, okay? Now in spite of my vaginal cytology and my ultrasonography, still I'm not able to diagnose, then I can go for vaginoscopy. Probably I make it kind of look for any tumors deeper in the passage, okay? Now radiography does not give me much information about this, and if I still don't get anything, I need to go for a clotting profile, okay? And you need to also do a complete hemoprotozoan. You need to completely screen the dog for hemoprotozoan diseases, because that again is could be a cause for vaginal bleeding in the case of canines, okay? So now with this, let's go on to the next case. A case number 4. It's a 4-year-old Cocker Spaniel female Milo. She whelped 5 live pups, okay, with the last pup delivered 24 hours before. Thereafter, there were no signs of parturition at all. Now, the owner who was experiencing whelping for the first time, he thinks parturition is over, but he still wants to get her checked up. Thankfully, he comes to you and he wants to get her checked up, right? So, this is a case where she whelped 5 puppies, last puppy delivered 24 hours before, okay? No signs of parturition. So now here, so what you do is after you obtain a history, you perform a vaginal examination, check for the presence of any amniotic vesicle or fetus. Then you're checking for the presentation of the fetus, whether it's anterior or posterior presentation. You're ruling out the presence of any strictures, masses or septum, anything. If it's there, I'm just trying to do a presentation to rule out all this, okay? And I'm also going to assess the tone and dimension of the anterior vagina, okay? So because if I'm going to introduce my finger and the dog strains, okay, there is satisfactory, so that means the uterine tone is there, okay? But a flaccidity indicates uterine inertia. So it could give me some amount of information. Then what I do is I'm going to check for any presence, and then if it is there, nature of amniotic fluid, it's bloody in nature or it's foul smelling, and then I'm going to palpate the abdomen and uterus for any pain, because pain is an indication of uterine torsion or rupture. Now this entire examination should not take more than 5 minutes. That's very clear. So you should be a rapid examination, and then what we do is we go for a radiography. Now we need to go for radiography for two views, okay? So where we are going to check for the number of fetus if it's there, okay? So here it's all it's there. So what am I doing a radiograph for? To check if there is any fetuses, and if it's there, the number of fetus and the size of the fetus in relation to that of the pelvic dam's pelvis, okay? So I'm looking for any feto-pelvic disproportion, and then again I'm looking for the position of the fetus and fetal death, if any, okay? If the fetal death is there, usually what happens, within 6 hours intrafetal gas pockets will appear, okay? Within 6 hours of fetal death. Now within 48 hours there will be overlapping of the cranial bones and collapse of the spinal column will happen within 48 hours. Okay. Now I also do an ultrasonography to check for the heartbeat. So normal heartbeat is 240 beats per minute, and if the beat is dropping down to less than 140 beats per minute, it indicates fetal hypoxia or fetal distress. Okay. So now this is what is the stepwise. I take the history, I do a physical examination, and then I'm going to go for a radiography to check all the things that I've told you about. Then I do an ultrasonography to check if there is a fetal heartbeat, okay, and what is the status of the fetus. Now what is happening in our case? Milo, the bitch is stable. There is no fetus in the passage. The vagina is also flaccid. The discharge is greenish black in color, okay. And on abdominal palpation, there is no pain, no mass, no pain, but I could feel some kind of a mass there, right? I'm not sure, because an involuting uterus or a retained fetus will give you a kind of a feeling, a similar feeling like that. So what's my next step here? Okay, what's the next step here? So let's say in my practice I don't have a radiography, okay? So let's say I do an ultrasound. So on ultrasound, I am seeing this, right? I don't see any fetal skeletons at all. So there is a fluid-filled uterus, which is perfectly normal for a post-whelp uterus to see that, okay? So there is a distended uterus with some amount of anechoic contents, and I don't see any fetus there. So I tell the owner, don't worry, there's no fetus inside, so absolutely everything is fine. I don't see any retained placenta also. So you can go back home, okay? Now the owner goes back home, but the very next day he brings this dog, and it's a dead dog, okay? He keeps it on your table, and he's totally distraught because the dog came walking the previous day, and now you have a dead dog on your table, okay? What if I'd done a radiography? Now this is what you will see in your radiograph, okay? You see a dead and an emphysematous fetus, okay? So the most important thing here you need to know, I missed this in my ultrasonography, because when there is going to be gas, you cannot visualize it in your ultrasonography. Okay, it gets the fetal fluids actually completely obscure the visualization of a dead fetus, and as a result your mistake has resulted in the death of the dam. Okay, so this is what you need to understand here. So a post-whelp, so what's your take home message? Though the bitch is stable, points to consider in decision making is that there is, first thing is a presence of a greenish black discharge 12 hours after the last puppy is born. Now that's the first point to consider, okay? We just left it off, we didn't think about it. But you need to understand, normally a greenish black discharge is there. It is because of the pigment called as utroverdin, and it is perfectly normal at the time of parturition, okay? Now, but this discharge, which is greenish black in color, it will be there for the 12 hours after the last puppy is born. Thereafter, it will change into a reddish brown discharge. It becomes mucosanguinous, sanguinous, mucoid, and finally it will disappear. So this whole process from a greenish black discharge to a scanty mucoid discharge, it will take a couple of weeks to a month, okay? But what happens is that if this discharge is going to be present even after 12 hours after the last puppy is born, it's a clear indication of retained fetus or retained placenta. So there are two take-home messages at this point, okay? The type of discharge you're seeing, a greenish black discharge 12 hours after the last puppy is born, is a clear indication of either a retained fetus or retained placenta. Now the next take-home message is that the post-whelp radiographic examination should always be your priority, okay? So once a dog comes to you for after whelping, the first thing you should go for a radiography, then check, and then if there is any fetuses inside, then you go for an ultrasonography to check for the viability of the fetus. So your priority should always be your radiography after a whelping. Okay. So then again, the time from diagnosis to emergency CS is very, very critical, right? So a lot of times we do this, right? Once you diagnose, okay, once I diagnose that there is a retained fetus inside, so most times we say, okay, let me finish this. I have around 15 more cases. Let me finish all the 15 more cases, then I'll go for a surgery, right? So, but by the time, this time is very critical because you're sure, because once there is an emphysematous fetus, it's very, very dangerous for the dam. So we have lost a couple of dogs like that. So that's why I'm trying to tell you is that the time from diagnosis to emergency CS is very, very critical. So try to intervene as early as possible and do a cesarean section as possible, as early as possible. Okay, so now case number 5, a 2-year-old mongrel female, Molly. She was spayed 6 months back. She's brought to you with a history of a sanguinous vaginal discharge. She was spayed, so she's been spayed 6 months back. She's brought to you with a bloody vaginal discharge or a sanguinous vaginal discharge. Okay, so I may be an expert in surgery, right? But I cannot do anything because once a dog, after 6 months, if she comes into heat or if she shows a discharge like this, then I have a couple of things in my mind. If I'm confident that, okay, my surgery was perfect, then the first things I'm going to think about is vaginitis, cystitis, cystic calculi, trauma, TVT, neoplasms, coagulopathies. All these are going to be a part of my differentials. But also the thing that should be in my mind is it an ovarian remnant syndrome or could it be a stump pyometra? Okay. Now these two are also going to be a part of your differentials, right? So let's assume that, okay, all the other things were not there. So now I need to rule out either an ovarian remnant syndrome or a stump pyometra in this case. Okay. So what do I do? What is my stepwise procedure? So I'm going to take a VEC to check stage the cycle, to check for the cells and stage the cycle. Then I'm going to perform a vaginal examination to rule out the presence of any TVT or tumors. I'm going to perform an ultrasound to rule out stump pyometra, cystitis, cystic calculi, and to visualize any ovarian remnants if it is there, okay, if possible. It's not so easy to visualize a remnant, but again, if possible. And I'm also going to do another test which is called as I'm going to test for anti-Mullerian hormone, AMH testing, okay. So let's say in this case, in our case, the vaginal cytology shows predominant of cornified cells. So obviously it indicates the dog is in estrus, right? So the one thing that should come into mind, okay, then this dog is in estrus, then the thing is possibility is this is an ovarian remnant syndrome, okay. Now on an ultrasound when I do, I could see small anechoic areas, okay, on the left ovary, which is nothing but multiple follicles. It gave me a confirmation, okay, now I have confirmed this case as an ovarian remnant syndrome, right? I want to further establish my confirmation. So this is where your AMH comes into play, okay. Now until now, you need to know what AMH is. AMH is this anti-Mullerian hormone. It's a glycoprotein which is going to be produced by the granulosa cells in the female, okay, in the ovary, and the Sertoli cells in the case of males. So here it's very popular as far as human medicine is concerned because it can actually tell you the amount of ovarian reserve that is present in an individual or in a female, right? So here what happens is, let's say for all women who are undergoing fertility treatment. So if I want to give FSH to induce follicle development, super ovulation, all this process, right? I need to know how much of, what is my response to the treatment. So before I go for that, we do what is called as, I want to check the ovarian reserve. So I go for this AMH testing, okay? So here clearly I understand it's very, very popular, but now it started gaining popularity even in the case of canine and feline medicine also, in reproductive medicine. So very clearly you need to understand. So I'm just trying to simplify this. When there is an ovarian tissue or a testicular tissue, AMH levels will be detected or will be high. Very clear, okay? So when there is a testicular tissue or an ovarian tissue, AMH will be there, it will be present, or it can be detectable or at high levels. So when there is no AMH or no testis, no testicular tissue, no ovarian tissue, then AMH will not be there or it is totally undetectable. Very clear on this, okay? Low or undetectable. So this is where is very clear. So that means spayed dogs or castrated dogs will not have any AMH levels at all. Very clear. Are you okay with this? But in the case of an ovarian remnant syndrome, if there is an ovarian remnant present, then the AMH levels will be detected. As simple as that. Okay, so in a spayed dog, if I want to confirm whether the ovaries are present, the best confirmative test is check for AMH. If the AMH levels are there, then obviously that the remnant is there. Okay, very clear on that. So you cannot claim that okay, my surgery was perfect, anything. Why? Because accidentally the possibility of a remnant left there is 100% sure. Okay, so I've given you a table, I've given you so many values. Don't bother about all these values. Okay, different people have quoted different values based on the test systems they've used. Some of them use human tests, canine based tests, but this AMH can be given to a human laboratory and tested. Okay, now if the value is more than 0.1, not 1, 0.1, that means it indicates it's positive for AMH. Any level less than 0.09, then it is negative for AMH. Very clear on this aspect. Okay, very simple. And again, in our case, the AMH levels was 2.14 nanogram per ml. So I know the dog means, that means there is a remnant present. So what do I do now? If there's a remnant, what do I do now? So the owner says, no, sir, I don't want this bitch to keep coming into heat at all. So please remove the remnant. So I need to go definitely. So my choice here is only to go for an exploratory laparotomy, right? But the question is when to perform the laparotomy. Do I perform it in estrus? Do I perform it in diestrus? Do I perform it in anestrus? Because I told you there, removal of the ovary should be done only during the anestrum period, right? But here in the case of an remnant, ovarian remnant, I cannot do the surgery during the anestrum period because I cannot identify the remnant ovary. So that means surgery has to be done only during estrus or during diestrus period. Okay. So here you need to understand when I am able to see either follicles or when I am able to see corpus luteum. Of course, the possibility of a clinical pseudo pregnancy causing it, happening could be always there. But in this case, if I want to remove the remnant ovaries, I have to perform it either during estrus or during diestrus. So this case, the surgery was performed during diestrus, and where you can see the corpora lutea present. Okay, so the ovaries are easily visible at this stage of the cycle. Okay, so now case number 6. You have a 3-year-old golden retriever female ginger. She was mated 47 days back. She's brought to you with a history of abdominal distension, purulent vaginal discharge, mammary gland hypertrophy and milk secretions. Okay. So now clearly this is a mated 47 days back. Now abdominal distension, purulent vaginal discharge, mammary gland hypertrophy and milk secretions are there. So here your differentials. So what are your differentials? So there are two things here. This dog has been mated 47 days back. So there's a possibility of pregnancy could also be there. So it could be pregnancy and it could be, but why am I having a discharge? It could be vaginitis or cystitis. Okay, so it could be normal pregnancy with or without vaginitis or cystitis, or it could be pseudo pregnancy with vaginitis or cystitis. Or the possibility is it can be Pyometra, because I can have the discharge because of Pyometra also, but with pseudo pregnancy. I cannot have pregnancy and Pyometra together. It's extremely rare. I won't say it's impossible. Unilateral Pyometras, okay, one horn pregnant and one horn Pyometra has been reported, but it's extremely rare. Okay, so in general, if the dog is pregnant, it normally doesn't go in for Pyometra. Okay, so you can have Pyometra with pseudo pregnancy. So this again the 3 possibilities in this particular case. So your history, how to narrow down your history? Was a pregnancy diagnosis done? Okay, because if it's a pregnancy diagnosis, obviously I know, then I can narrow down the reason for my discharges. And when do you see the discharge? At the time of urination, or I see it every time whenever the dog sits and gets up and walks around. Okay, so that's again. So I do a physical examination, I do a general examination, mammary gland examination, and where I see the mammary gland is hypertrophied, hard to palpate, serous secretions present, and I do a genital examination. Okay. Now based on this, my diagnostic procedures. I have 3 diagnostic procedures in hand here. So it's cytology, ultrasonography and radiography. Now what if I do a cytology? My cytology shows here intermediate cells with lot of neutrophils, right? So obviously this is a case of diestrus, but plenty of neutrophils suggest it could be vaginitis or it could be a case of Pyometra. I still need another diagnostic procedure to confirm my diagnosis. Okay, but what if I do here, I am performing a radiography. Okay, I have an ultrasound only, okay? But if somebody who doesn't have an ultrasound performs a radiography, now you're able to see uterine distension. You see very big huge distension here with no fetal skeletons at all. So is this a confirmed case of pyometra? Can I confirm this case as pyometra then? No. Here you need to clearly understand this is you're doing a radiography and this dog was mated 47 days back, okay? And if you're not able to see fetal skeletons in an x-ray, it does not eliminate pregnancy. Please understand that. Though your textbook says I can see the fetal skeletons in an x-ray by 45 days, it is always 45 days from the LH search, not from the date of your mating. Please understand that, okay? Let's say you breed the dog today, but you have an LH search 5 days later. So your radiography of 45 days comes from here, not from the date of your mating. So what happens is when you're early with your radiography, you may not see fetal skeletons in an x-ray at all. Then also a possibility is in some dogs, the fetal skeletons are visible only after 52 to 53 days. So there again, you'll miss a pregnancy. So the most important thing is you cannot 100% confirm that the dog is non-pregnant and it has pyometra based on your radiography. Okay, so that is why I said an ultrasound would be a better option at this point of time, where I can actually look for these anechoic saculations, okay, with hypoechoic or mixed echogenicity, contents of mixed echogenicity, which is 100% confirming that there is no pregnancy. It's 100% a case of pyometra. Okay, you're okay with this? So that means, so now I've confirmed the case to be a pyometra case. So now what? So why am I then having mammary gland enlargement or milk secretions? So this is a case of pyometra with pseudopregnancy, where you need to understand pseudopregnancy can coexist with other reproductive or non-reproductive clinical problems, sometimes making diagnosis difficult. Okay, so a lot of times people say, I've seen in my practice dogs with pseudopregnancy go to pyometra, or pyometra leads to pseudopregnancy. No, it's not like that. Both are two different entities. The causative factors are different in both the situations, but they can coexist or exist together. Okay, so clearly you need to understand that. Okay, so now that is a case where I have a pyometra also with pseudopregnancy. So can I go for OHE to treat this pyometra? Now this is a problem for me, right? How do I approach it? Can I go for an OHE? Now what happens if I go for an OHE at this stage? This dog is in diastrum, right? So what happens is it will trigger off an episode. So usually when I'm going to do a surgery during the diastrum period, it will trigger an episode of pseudopregnancy 3 to 7 days post-surgery. But when the signs of pseudopregnancy have already started, then that will result in an extended pseudopregnancy, sometimes for years. So since already the signs of pseudopregnancy has started in this particular dog, my OHE at this time is again going to trigger a semi-permanent condition, a lifelong situation. So how do I deal with this? What do I do with this case, right? Is there a medical alternative? So I can instead, what I can do is I can medically treat the dog with prostaglandins or with antiprogestins such as aglipristones, okay? So now prostaglandins is that. So basically here my aim is I'm trying to, get some time, right? So where I'm going to treat this dog, I'm making sure I'm going to evacuate all the pus out, okay? I'm going to treat it, but then still my ovarian hysterectomy is going to be my primary option, right? So what I'm going to do is I'm going to go for prostaglandins, and here every prostaglandin therapy has to be combined with a broad spectrum antibiotic, okay? So we go for either natural PGF2 alpha, which the dose rate of 100 to 250 microgram per kg body weight subcutaneously BID for a period of 8 days, okay? And or I can go for analogs of PGF2 alpha such as cloprostenol at the dose rate of 5 microgram per kg body weight subcutaneous SID. So here you see it's a BID protocol, twice a day protocol. Here it's a single day protocol for a period of 8 days. Now here what happens is your action is that it's going to act on the uterine muscles and bring about contraction and evacuate the contents out, okay? And it's going to actually cause a regression of the corpus luteum. So thereby the effect of progesterone is going to be decreased, right? But the problem is that it not only acts on uterine muscles, it acts on all the smooth muscles of the body. So the moment I give PG, it will have vomition, defecation, salivation, tachycardia. So all these side effects will be seen, but none of the side effects are lethal. They are only transient, and you can counteract the side effects by concurrent administration of atropine prior to your PG administration. Okay. Now with chlorprostonol, the side effects are much more minimal, very, very minimal. Okay, because the affinity towards the CL receptors are more than the smooth muscle receptors. Okay, so once I treat, I keep monitoring the dog with an ultrasonography, and once the complete discharge is stopped, the leukogram is normal, and a normal ultrasonography and radiography finding is normal, I am going to completely stop my treatment. Okay, and I'm going to reevaluate the dog on 14th day and look for all these changes, right? The most important thing is your prostaglandins will not completely eliminate an underlying infection. So there'll be small amount of infection. So you need to make sure that the dog is mated during the next heat and she becomes 100% pregnant. Okay. So that's again a thing. And I told you the other option is to go for aglapristone. That is an antiprogestin such as aglapristone, now commercially available as Alizin. It's available in the market. So we're kind of talking about it very freely. Now this is an antiprogestin, so we all know progesterone is responsible for the development of Pyometra. Okay, so what happens with these antiprogestins is they go and compete with the not natural or the naturally occurring progesterone for its binding sites. Okay, so the affinity towards the binding site is almost 3.5 times more than the natural progesterone. So what happens is that, so that means the natural progesterone will not be able to bind. As a result, its action is not there, right? So the dose of generally aglapristone is 10 mg per kg. We give it for mostly three injections, 1, 2 and 8 on days 1, 2 and 8. And if required, if I see still there's a discharge, I can go on day 15, right? Now, combining aglapristone with chlorprostonol has found to give better effects, okay? Where I'm going to give aglapristone on days 1, 2, 8 and 15. And in between, I'm going to go for chlorprostonol at the rate of 1 microgram per kg subcutaneous on days 3 and 7. So here, the advantage is that I can use aglapristone even in the case of a closed pyometra. I cannot use chlorprostonol. I cannot use prostaglandins in closed pyometra. But I can go for antiprogestins in closed pyometra, where it initiates a cervical opening by around 12 to 72 hours. And I can see the emptying of the contents within 6 days. And within 24 to 48 hours itself, I'll be seeing an improvement in the general condition and the return of the blood parameters to normal within 8 days. Now, because of the side effects with chlorprostonol, okay, in cases of high-risk bitches such as brachycephalic bitches or in older dogs, you can safely go for aglapristone for treatment of Pyometra. Okay. Now, what else do I need to treat this dog? I need to also deal with a pseudo pregnancy here, right? So I'm going to go for gabagoline at the rate of 5 microgram per kg once a day per os for a period of 10 days, and I put it on. I put the dog on e-collar, that's to prevent self-mutilation, and I'm also going to put the dog on hot and cold water compress in case of severe edema. I'm giving antiprogestins along with antiprolactin drug. I'm treating the condition, medically treating the condition, and then I'm going to go for an ovarian hysterectomy once the dog recovers from all this. Okay, I think do I have time, doc? Then case number 7, it's a 4-year-old boxer female. It's Millie. She's in heat for the past 1 week. And she's presented within 24 hours after an alleged mismating for treatment, as the owners did not want the bitch to have any puppies. Okay, so this is a very clear case of MTP, and he's bringing to you within 24 hours after a mismating. Okay, now the first thing you think about is estrogens, right? But one thing is, are estrogens safe? It's very important for you to understand that, okay, because estrogens are known to produce dose-related, often irreversible bone marrow suppression, and with a dose that is safe for one dog may be toxic to another individual, okay, so which may lead to severe anemia, thrombocytopenia, and even death of that particular dog. And also estrogens increase the or predispose the dog to go in for Pyometra, so therefore they increase the incidence of Pyometra. So therefore the potential adverse effects of estrogens need to be considered before choosing this as a treatment option. So then what next? What else can I do? Okay, so what else can I do? So now here what you need to understand is that there's something which is very unique in the case of canines, which is going to help you in understanding of your termination protocols. Here, for any species for that matter, for any species, for an establishment of pregnancy, for a pregnancy to be established and for the corpus, see, you need a corpus luteum to maintain, to produce progesterone continuously throughout pregnancy and to maintain the pregnancy, right? So there should be something that establishes, that is a signal for the maintenance of the corpus luteum, so that progesterone is being produced and pregnancy is maintained, okay? And usually that signal comes from the fetus itself, okay? We call that as an interferon tau, which is going to be there universally in all the species. But in the case of canines, there is no pregnancy recognition system at all. First, you need to understand that, okay? Whether the dog is pregnant or non-pregnant, the corpus luteum is going to remain functional. So, let's say I am having 7 dogs which are non-pregnant and 3 dogs which are pregnant. Okay, in all these 7 dogs also I am having a corpus luteum. In these 3 dogs also I am having a corpus luteum, because there is no pregnancy recognition system at all in the case of canines. Okay, so that means in these 7 dogs also progesterone is being produced. In these 3 dogs also progesterone is being produced. So that means progesterone cannot be used for pregnancy diagnosis in canines. Okay, it's present both in pregnant and non-pregnant dogs. Okay, that's first thing. Now I also told you before itself is that you require a hormone to maintain the corpus luteum. LH is lutotrophic in most species, but in case of canines, the major lutotrophic hormone is prolactin. So I'm going to have prolactin both in non-pregnant dogs as well as in pregnant dogs. Am I right? Correct? Because I have a CL both in pregnant and non-pregnant. Obviously, I should have prolactin both in pregnant and non-pregnant dog. So the major lutotrophic hormone is going to be prolactin in the case of canines. Okay. Now, I also mentioned to you is that up to 30 days, the corpus luteum is independent of lutotrophic support. It functions autonomously. Okay, so that means any drug to bring about the regression of the corpus luteum, I cannot do it before this 30 days at all. Very clearly you understand. So any drug that I want to administer to bring about the regression of the corpus luteum, I cannot do it before 30 days, because here the CL is not responsive to the exogenous luteolytic agents, and also it functions autonomously. Now after 30 days, now the CL can respond to exogenous luteolytic agents, but even then the resistance is very high. So repeated administration of drugs, luteolytic agents are required to bring about the regression of the corpus luteum. These are small take-home messages that you need to think about when you're trying to talk about medical termination. So termination drugs are mostly effective only after day 30 and not before that. Okay. Now the second thing is that the corpus luteum of the bitches is highly resistant to luteolytic agents, and repeated administration several times a day is an absolute requirement. Okay. And treatment should be continued. The most important thing is that once I start a termination protocol, I have to go on giving the drug until all the fetuses are absorbed or expelled. Okay. Then only I should stop the treatment. Now the reason is that I require only 2 nanogram per ml of progesterone to maintain pregnancy, and in a dog I have nearly 50 to 80 nanograms. Such a high level is there. So I'm repeatedly administering the drug so that the level comes down to less than 2, fetal expulsion will start. But the moment I'm going to stop the treatment, the progesterone levels can go back to normal and pregnancy can be maintained. Okay, so that is why your another take home message is that I have to go on giving the drug until all the fetuses are expelled or absorbed. Okay, and treatment should be verified only with the help of an ultrasound. Partial resorption of litters happen if the treatment is discontinued prematurely. Okay, so with this small note, let me go on to the termination protocols. Okay, so now pregnancy in the bitch can be divided into 3 stages, stage 1, 2 and 3. Now stage 1 is associated with from fertilization to implantation. It goes up to day 22. Stage 2 is from day 22 to day 42, and stage 3 is from day 42 to 65. Now the best when to terminate is the best stages between is stage 2, where it is usually related with resorption. Most of the time it's associated with absorption of the fetuses rather than expulsion, where you will see it here, which is more traumatic to the owner. Okay. So then now my treatment plan. What's my treatment plan? So my treatment plan is to first confirm a pregnancy. Second thing is that then I need to go for a medical termination of pregnancy, and then I need to monitor the efficacy of my termination protocol. Okay. Now how do I confirm? So I need to go for an early pregnancy. At 30 days, I'm telling the owner I cannot do anything at 24 hours. Come at 30 days. let me confirm a pregnancy at 30 days and let me terminate the pregnancy. Now, how will you confirm a pregnancy at 30 days? Can I go for an abdominal palpation? No, it's not a foolproof method of pregnancy diagnosis. Okay, so here, chalo, let's say you don't have an ultrasound with me. This dog is pregnant, right? Okay, and you started your treatment protocol. But what does the rule say? You have to go on giving the drug until all the fetuses are expelled or absorbed. So when you don't even know how many fetuses are inside, then when do you stop the treatment? So that's why we say an ultrasound becomes an integral part of your MTP protocol. Okay, so I need to confirm a pregnancy. Once I confirm a pregnancy, calculate the age of the fetus. Now I start the termination, right? So now here very clearly, you know the corpus luteum produces progesterone. Progesterone in turn helps in maintenance of pregnancy. And you all know prolactin is responsible for maintenance of the corpus luteum. If I want to terminate a pregnancy, I can go for anti-prolactin drugs. I can cut off the prolactin support by going for anti-prolactin drugs such as bromocriptine, gabagoline and metagoline. Now, we will only talk about gabagoline because bromocriptine has got severe side effects. We never use it anymore. Metagoline is not available, so gabagoline is the drug of choice for an anti-prolactin drug. Okay. Now, if I want to regress the corpus luteum, I can go for leucolytic agents such as prostaglandins, right? So here again, and then I can cut off the progesterone support by going for antiprogestins such as mifepristone or aglapristone, right? In any ways, the progesterone is going to be removed. As a result, the pregnancy is going to be terminated, right? So now this is the drug dose and route of administration. So here, when I'm going for antiprolactin drugs, the dose rate is 5 microgram per kg body weight per os. BID. Remember, all termination protocols are BID protocols. So BID, you have to go on administering the drug until all the fetuses are absorbed or expelled. Okay, that's the thing. Okay, and here with leucolytic agents such as prostaglandins, you go for natural PGF2 alpha or you go for cloprostenol. But I would always prefer to go for cloprostenol. Okay, because this is the dose is 5 microgram per kg subcutaneous. SID. So here alone you are seeing SID protocol because I told you it has a greater affinity towards the CL receptors than smooth muscle receptors. So the action is also prolonged. So that's why we prefer to go for cloprostenol. And the side effects are also minimal when compared to the natural PGF2 alpha. So natural it is 0.1 to 0.25 milligram per kg. Here it is 5 microgram per kg. So now most important is that, okay, I think the next slide it comes to. And when it comes to antiprogestins, here we are going for mifepristone and aglapristone. Okay. Now mifepristone is Ru486 and the dose is 2.5 mg per kg per os BID for a minimum of 4.5 days. So we were very happy when mifepristone came into practice because, you know, it's a human drug, right? It's a human abortifacient and, you know, it has an endpoint of 4.5 days because all other treatment protocols, we say you have to go on giving the drug until all the fetuses are expelled, everything. So when mifepristone came, we were so happy because it has an endpoint of 4.5 days. But what we realized is that mifepristone alone did not work in most of the cases. Okay, so we had to go for combination protocol. So there again, we had our own apprehensions when mifepristone was there. But when aglapristone came just now, a couple of I would say probably in 2025. Okay, in the late 2025, we started getting in 24 or 25. We got aglapristone, and here the advantage with aglapristone is that you can administer it from 0 to 45 days. So 0 to 45 days itself. So here you are not aiming at the corpus luteum at all. So here it's an anti-progestin. You're preventing the effect of progesterone to happen, and this can be administered from 0 to 45 days. So just 2 injections 24 hours apart. Okay, so this is again the advantage of your aglapristone. So with prostaglandins, I told you there are a lot of side effects with prostaglandins, and as a result I can counteract the side effects by concurrent administration of atropine prior to my PG administration. Okay, fine. So here now what I would prefer, I would actually prefer to go for combination protocols, right? Okay, so here I can go for gabagoline with prostaglandins, or gabagoline with antiprogestin with prostag, any combination I can go. Okay, I can go for all the three drugs also at the same time. Any of the drugs I can go, because actions are different, but ultimately they aim in termination protocols. So that means whenever a client, so your the combination protocols, so usually two combinations are okay, but if you want to go, if the client is affordable and maybe he comes a little bit too late, right, beyond 50 days, I would prefer to go for all the combinations. Okay, and along with this I would also go for misoprostol. Okay, now misoprostol is prostaglandin E, which is nothing but it helps in actually cervical dilatation, right? So here the dose is around 400 microgram. Availability is 200 microgram tablets. Okay, so I place it intravaginally. I don't give it oral. Okay, it's a human drug available for oral administration, but we go for intravaginal administration, and we go for twice administrations at 48 hours interval. Okay, now the inclusion of misoprostol in your termination protocol, we have almost seen terminations happening within 3 days itself. Okay, so it helps to shorten the time taken for fetal expulsion. So with all this, I'm also going to do repeated ultrasounds. Okay, so once I start a termination protocol, up to day 3 or 4, I don't expect anything to happen. Thereafter, I keep monitoring the dog every alternate days with my ultrasound until there are no more fetuses present, all the fetuses are absorbed, or all the fetuses are expelled, and then I stop with my termination protocol. Okay, so finally the last case, this is a small case, not a big elaborate case like the previous one. So you are presented with a 3-year-old pug with a prolonged bloody vaginal discharge, more than 30 days, the bleeding is there for more than 30 days, attracting male dog, and with concurrent mammary gland hypertrophy and milk secretion. Okay, this is very peculiar. The dog is in heat and it has mammary gland enlargement and milk secretions. It doesn't go together at all, right? Now this is an actual case that was presented to me from Hyderabad, and this doctor has treated this dog with an antiprolactin drug. They treated it for pseudo pregnancy with bromocriptine for 10 days with absolutely no response at all. So absolutely no response. They put it on antiprolactin drug, there is no response at all. So when this dog was presented to me, on the case was presented to me, I said, are you sure the dog is in heat? Because this is a big confusion for me, right? Because my first thing is, are you sure the dog is in heat? Then yes, the veterinary doctor, she was 100% sure, yes, my dog is in heat, because I checked her, I checked for smears, everything I checked, and the dog is 100% here. Then if she's in heat, then how can she have mammary gland enlargement? Because pseudo pregnancy is a symptom that you see only at the end of the diestress period. Please recap. That's why I took the basics for you. Okay, this is why when we say is, when you're analyzing a case, you should be able to understand the logics behind the case, right? Okay, so when I have a case like this, there is an estrus, but how can I have mammary gland enlargement? Because mammary gland enlargement, pseudo pregnancy happens only with the end of the diestress period, but this dog is in estrus. How is this possible? So I'm confused. And if the dog is not in heat, then I need to look for sources of bleeding. So I'm totally at loss for this case, right? So my differentials, as usual, for a bloody vaginal discharge, all this is going to be there. I'm asking the vet, did you eliminate all this? Ma'am, we eliminated everything, nothing at all. But I did a smear, and the smear, the vulva is swollen edematous. She's attracting male dogs, and the smear shows predominant of superficial cells, which indicates the dog is an estrus. Okay, so now that confirmed the dog is an estrus, then how do I have mammary gland enlargement? What is this case actually? So now here clearly you know that a dog in estrus cannot have pseudo pregnancy. But you need to also, whenever you have mammary gland enlargement, please don't ever always think about pseudo pregnancy. Okay, in other words, your thought process should be galactoria due to hyperprolactinemia, right? Okay, there are increased prolactin levels, and this increased prolactin levels is causing a mammary gland enlargement. So it doesn't always have to be a pseudo pregnancy. Okay, so where are the situations where you'll have, so where is, okay, this way, let's go this way. Where do you have prolactin? Prolactin comes from the pituitary glands, right? Okay, so in situations where you will have hyperprolactinemia is when you have hypothyroidism, right? So when you have hypothyroidism, because of a lack of negative feedback on the pituitary, obviously there will be increased secretions of prolactin as well as the thyroid hormones, I mean TSH, and that also, so hypothyroidism will cause hyperprolactinemia, and again pituitary tumors or microadenomas of the pituitary, now they also will cause hyperprolactinemia, right? So in this case, what we did is we checked for hypothyroidism, and this was a classical case of hypothyroidism, right? Where, as I already told you before, so here the hypothalamus produces TRH, acts on the pituitary, causes prolactin and TSH, okay? Now TSH is responsible for T3 and T4. Now what happens is if T3, T4 is not sufficient, so usually the levels of TSH and prolactin are being maintained by a negative feedback effect of T3, T4. If T3, T4 decreases, then obviously this negative feedback on the pituitary is not there. As a result, the prolactin increases, TSH will also increase, okay? So in hypothyroidism cases, you all know the effect on reproduction will be, there will be prolonged proestral bleeding, prolonged interestrous intervals could happen, a dog failure to cycle, and it could be a case of silent estrus. So normal T4 levels are usually around 1 to 4.7 microgram per deciliter. So decreased T4 levels with increased TSH of more than 0.6 microgram per liter is consistent with diagnosis of hypothyroidism. Of course, you need to clinically correlate the situation also. So treatment is with levothyroxine at the rate of 0.02 milligram per kg once daily. So I think with this, my presentation is complete. So this is my phone number, my contact number. You're free to contact me anytime in WhatsApp. I can always help you with your cases if you have any doubts at any time possible. And thank you so much.
Ma'am, vets are, thank you so much. It was a great presentation. Many vets are asking the name of your book once again and from where they can get it.
So, yeah. So so my book is on canine reproduction theory and practice. Unfortunately, I just have only 5 more copies with me probably, and I am not going to be here because I'm just doing a print on demand currently, right? Okay. So every time I'm just printing on demand, I keep doing it, and since I'm not going to be there for the next 6 months, so probably after when I come back there, I just have 5 books with me. That's the thing, right? Okay. So
limited edition available.
Yeah, limited edition available. Thank you so much. Somebody said.
What is the price of this book?
Yeah, the price of the book is 3,000 rupees, doctor. 3,000 rupees, and the plus your courier charges. Actually, now the prices is going on increasing right now because it's on print on demand, right? So when you go on a mass scale, the prices are going to get slashed. So obviously, and since it's all 300 pages of color with all color images, so obviously the price is going on increasing right now.
Yes, I can understand the slides and gynecology without slides and everything is useless.
Exactly.
So it has to be there.
Thank you so much.
Great, ma'am. And ma'am, please see the chat box if there are any questions for you.
I think there was one where somebody was asking me, can aglapristone be given for MTP before 35 days? Yeah, obviously. Aglapristone, only the biggest advantage with aglapristone is it can be given from day 0 to day 40.
Yes.
That there was a question somebody asked.
I have used it and I have seen the results. Even in later stage, even the whole puppies came out.
Yes.
The fetus came out.
So the biggest advantage with aglapristone is that it's the 0 days, right? So which no other drug can be given before 30 days. So this is the only drug that can be given at 0 days to 45 days. Only thing is the cost involved in it. But again, if the person is affordable, I think it's a safest drug to go ahead.
One question from my side, ma'am. As it is happening, and the same thing while using aglapristone, I had a case which was a female, this Siberian Husky, but after that she developed symptoms of Pyometra. Okay. So we had to did the spay.
Okay, but was it you terminated her?
Yeah, we terminated her with the aglapristone.
Okay, and then when did she develop Pyometra?
Within 45 days. Within 45 days.
See there again. See, that's what you're talking.
I don't find any relation, But that was just a query, as it is a gynecology thing happening, and
I know.
it suddenly
See,
came.
but you did an ultrasound to check for the pyometra, isn't it? Or was it
No, it
vaginitis?
was thorough ultrasound. Ultrasound was done. Yeah, it was
Okay.
thorough laboratory report. They confirmed that it is biometric confirmed. Then we
Uh-huh.
had to proceed, and even the client was interested that we should go for the spay.
OH.
But as it was a case of biometra, and we just did the abortion with the aglepristone, so could it be something like related to each other?
No, it can never be related to each other because once you terminate a pregnancy, for example, let me say this way, let's logically think this way. Once you're removing an entire thing, and then now once you terminate a pregnancy, the dog is going to only enter into anistrum, right? And unless and otherwise there were remnant inside, and she would have developed a pyometra immediately related to the remnants. Okay, but
Okay.
after
Okay.
45 days, there is no logical explanation. There is one possibility is maybe extremely rare, but after anistrum, the dog could have had a very short proestrus, estrus, and she would have also entered into diestrus, which could have triggered a pyometra. Or it could be a
Okay.
cystic endometrial hyperplasia, which happens at any stage.
Okay.
Okay, you
Okay.
get my point. Pyometra is
Yeah.
diestral, but cystic endometrial
Yeah. Yeah.
hyperplasia is something where the endometrial glands become cystic and dilated. That's because of repeated exposure to progesterone. So there again, it's all ifs and buts, but it's a very peculiar thing. Within 45 days, developing a pyometra is very peculiar. But possible reasons are
Yeah.
this. Yeah, so I
Yeah.
can only think about immediate means maybe the remnants would have been there and it would have caused an infection. Yesterday,
Okay.
somebody came up with a case that after aglepristone, the dog died, but it cannot cause because aglepristone never
Yeah,
causes
no, no,
anything.
it's not.
No, but it died.
Yes.
It died, right? So maybe there again, the reasons we are explaining is maybe the uterine rupture could have been there, which would have caused, subsequent
Yes.
peritonitis.
Yes.
But by
Yes.
itself, aglepristone does not cause contractions. You get my point into it. So there, the whole issue of if I'd given prostaglandins and then I can say, okay, it would have caused contraction, it would have caused rupture. But here it's not possible with aglepristone. It's a perfectly safe drug. So, the relation is not to the aglepristone at all.
Great.
Okay.
Right. Please have a look on the chat box if there are some other questions too.
Need guidelines on one case of anistrum. Previous the same which was showing symptoms of anisthus that kept on zinc supplementation, but this year I tried again. Not in estrus. Thyroid levels also checked, which is normal. Okay, excellent. Right. So this is a case of anisthus. So somebody said, thank you so much for the presentation, ma'am. Yeah, previously the same bitch was showing symptoms of anisthus that time. I kept on zinc supplementation and multivitamin. She got her estrus. But this year again, I tried again, but still the female is not an estrus. Thyroid levels are also checked, which is normal. What should be my approach to this case? Okay. So now you see anistrum. First thing is you have to really confirm whether the dog is in anestrus. That's the most important thing, right? Most often the so-called anistrum cases, when we check them, we find that they would have had a silent heat in between. Okay. Now the reason why I'm trying to talk to you is when I want to induce an estrum in an anestrus dog. This dog should be really in anestrus. Okay, that's what you have to understand. And for example, let me put it this way. Now, your induction of estrum in an anestrum dog involves administration of gabagoline. So, gabagoline is administered. It's an anti-prolactin drug, and it's also the drug of choice for induction of estrus in anestrus dogs. So, the dose here is 5 microgram per kg body weight once a day per horse. You have to go on giving the drug until the dog comes into heat. So minimum of 4 days it can take, maximum of 40 days it will go. But provided the dog is in anestrum. So for checking this, you need to do a cytology. You should be thorough with your cytology. So when you take a cytology smear, lot of times what we do is if it's anestrum, the predominant cell type will be parabasal cells. Okay. But instead of parabasal, if I'm getting lots of intermediate cells, obviously it indicates the dog is in diestrus. That means she must have had a silent heat before. Okay, she must have gone through proestrus, estrus, and then only she can enter into diestrus. So that itself indicates that case is a silent heat, and that's why you're not seeing signs of estrus at all. So there, your induction protocol will not work. Please understand. So confirm the dog is an anistrum. If she's an anistrum, go for gabagoline. You can also put her onto what you call that as clomiphene citrate. Fertobid or Fertomid, which is 25 or 50 mg tablets, one tablet per day. You can go for 5 days, induction for 5 days. They are non-hormonal ovarian stimulators. You can go for clomiphene citrate and then you can start the dog on gabagoline for a period of, there is no period. You have to go on giving the drug, so you don't give a prescription for 40 days, give a prescription for 10 days and then tell the owner if it doesn't come into heat, continue the drug till she comes into heat and for the first 3 days after she comes into heat. So that's with your induction protocol. There are no other drugs that can actually induce estrus, but confirm whether she's really in anistrum. That's the most important point, right? Okay. And any other... Somebody is asking where to access the previous lecture on feline reproduction. A couple of people asked me that. They missed the lecture.
Ma'am, actually, this was something like, my team creates a edited version, then I have to go through with it. And sometimes there are some glitches, then I have to redirect them. And I personally observe all these things. So that's why they are being delayed. But we promise you this week, maybe in 10 days, both the lectures will be uploaded. This is a promise from our side.
Absolutely, absolutely. So, did you mention aglaprostone can terminate pregnancy from day 0 to 45? Can't we use mifepristone alternatively for the same? Okay, good question. Or mifepristone can also be used, but mifepristone seems to be effective only after day 30. So the 0 to 30 is not very effective, okay? And currently mifepristones are very difficult to get actually. So I don't know. Fortunately, we've got aglapristone now.
Yeah, and even it is not 100% effective, ma'am. I have seen failure cases.
Exactly.
Yeah.
So that's why when I use mifepristone, I use it with combination protocols. I use mifepristone with gabagoline or mifepristone, misoprostol, gabagoline. So I mean, that way it's going to be there. By alone, I feel it doesn't seem to be bringing
not effective.
Exactly. And dose of clomiphene citrate to induce. See, I'm not using clomiphene citrate to induce estrus. It's just a non-hormonal ovarian stimulator. I'm giving the drug before the starting of gabagoline. Okay. So this drug is actually clomiphene citrate is I can go for 25 to 50 mg tablets. Okay. It's available as 25 mg or 50 mg tablet, one tablet per day for 5 days. And then I start with gabagoline. Okay, so somebody is asking you, can I change the webinar time at 6 p.m.? Anyway, I'm done with it today.
The problem is 6 p.m. is good for the government vets, but the 6 p.m. is not good for the private practitioners. So we'll try to make, actually this time, Dr. Saab, we already had an appointment for trying to had an appointment for last 3 years. And this time we got the appointment. Otherwise, ma'am has to go and she's leaving India in another 15 days. So that's why she didn't have time. Otherwise, we try to keep all these webinars on weekends only, so that both private practitioners and government practitioners, they are free. So sorry for this inconvenience. And you will, those who missed some portion of the webinar, if you have missed, you can again watch it on the YouTube. It will be there soon uploaded. Yeah.
Yes, doc. And can you please brief on relaxin test for pregnancy confirmation, brand availability? Okay, currently, relaxin, it's very specific for canine pregnancy and it's being produced mainly by the canine placenta. So it's an amazing test kit and very simple test. Within 5 to 7 minutes, you get the result, okay? Now, the only issue is I've worked with imported kits. Currently, there's a person in Andhra, they're actually manufacturing these kits, but somehow I'm not very comfortable with it. They need to work on that. They still need to work on those kits. So I right now I can't talk to you about brand or availability because it's not available in India. So commercially, I mean from US, I've worked on a kit called as Witness Relaxin. Amazing test. Is it right to use estrogen for MTP immediately at day 0? No to estrogens, please. So that's my first slide in MTP itself. No to estrogens. This time is good for all. I think that's it. So thank you, doctor.
So thank you so much, ma'am. On behalf of all the participating vets and the Oriheal team, we thank you so much for your excellent session on navigating canine reproduction protocols, pitfalls, and practice. Your presentation was really clear, practical, and easy for everyone to follow. You made complex topics simple, which gave all the vets much more confidence when dealing with the tricky reproduction cases. Your deep knowledge and passion for teaching is real inspiration. We truly appreciate your support and your important role in Oriheal's ongoing webinar series. We look forward to working with you and learning with you again soon. Thank you so much again for your valuable time and effort, ma'am.
Thank you, doctor. Thank you so much. Thank you, everybody. Thank you. Good evening. Good night.
Okay, ma'am. Good evening.
Thank you, doctor.
Most trusted pharmaceutical company for companion animals of the year goes to Oriheal Lifesciences Private Limited, Dr. Vishal Sharma from Oriheal Lifesciences Private Limited.